Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Hello everybody, and welcome to another edition of For the Health of It Cowley County. It's Tom Langer and
Allie Payne.
And we today are on location at the it's not the City-Cowley County. We're in our booth, but we're actually at the Cowley County Health and Safety Fair, which is out at Barn 4 on the Winfield Fairgrounds. It's a wonderful Saturday morning, and we're doing something different. We're endeavoring to take this podcast on the road and do it on location. Today's going to be a little bit different. We're going to do our normal intro.
Right.
So, Allie, how you doing?
I'm doing well, thank you.
You ready for this?
Yes, I'm excited.
Yeah, this is pretty cool. What we're going to do is just give a little bit of information about everything that's going on here in case you've never been to a health and safety fair, so maybe we can entice you to come to one the next time we have it. And also we're going to grab individuals that are both visiting the health and safety fair and those that are here as exhibitors and have them throughout the day tell us a little bit about themselves, what they've learned, what they've seen, and hopefully it will give you an idea about what's going on in Cowley County in the health and safety area. Allie, what do you have to say?
I think that this event is really neat. This year we have over 40 different exhibits. There are lots of door prizes. There are plenty of people here. This event is free. It's a good time.
Yeah, those door prizes too. They're cool. I mean, I've taken a look at some of them that they have on the table, and there's others that that aren't being shown, but there are like pictures of them, and there's some really neat stuff. The one thing that we really want folks to know when they come out to this is we really want to put them in a frame of mind to think how they individually can contribute to wellness and safety and all of those things in the community. Allie, you asked me a question yesterday as we were setting up our booth, because we were talking about how were we going to approach this format today. Do you remember what it was? It was about what would I do, or as an individual, if I could make a change,
Yeah, we had a few of those. I think we talked about the health campaign, what you might do.
If you've got that question, read it out, because let's answer a couple of those in this opening segment, just to kind of get people in the right
no
frame
problem.
of mind.
All right, let's see. That one in particular says, if you could design a health campaign for your community, what would it be about?
Yeah, and I thought about this, and we talked, and we said, it's all about our behaviors and how difficult those things are to change. But I think it came down to a couple of things, and I'm going to challenge everybody to do that. And it's going to be a water drinking challenge and a walking challenge, those two things. What we would like to do is we would like to encourage people to begin a routine where they can walk up to 1 mile per day, right? It's not very far. I mean, when you consider it's probably about 7 or 8 blocks out and 7-8 blocks back home would be the equivalent of a mile walk. You do it at your own pace. Don't overdo. Do it as slowly as you need to, or do it as quickly as you can, or even increase it if you're in better shape. And then the other thing is to drink enough water. I think most people do not consume enough water on a daily basis, present company excluded. I don't know how many gallons of water you drink every day, but we would challenge you to drink at minimum 64 ounces, which is the equivalent of what did you say?
Or 8 cups.
Bottles?
So 4 of the traditional just plastic throwaway water bottles.
Little bottles, yeah. That's 4 bottles of water. That's not much. As a matter of fact, if you can up that 64 is the equivalent to, what do we say, to about a half a gallon of water a day?
Yes.
And if you can double that, you can get close to a gallon of water per day. Your body is going to get the fluid that it needs to help it work better. So anyway, that's one of the things. Allie, what would you do?
Oh, that's a good question. I should have taken the evening to think about it as well.
Well,
Yeah, I like what you're saying. Just get out and get some steps, especially right now with the time of year it is. The weather's improving. There are a lot of things that you can do outside that aren't super taxing but are super great for your health.
Yeah, absolutely. We talked about this. It's, so many times when you have these things, you're made to feel guilty, or you're made to feel bad. You got to lose 30 pounds or 40 pounds or whatever it is. Well, that's daunting, and that nobody wants to do that. But here's the thing. If you go ahead and you sit there and say, I'm going to drink 64 ounces of water a day, 4 bottles of water a day, and I'm going to walk a mile every day, and maybe you cut back a little bit on some of your eating, just a little bit. You don't have to change your style. watch what it does to your body.
Yeah, substitute some of your pop for your water.
Yeah. Don't drink the sugary stuff. Substitute water or unsweetened tea or something of that nature. That's kind of my go-to. But anyway, that's the whole idea. And anyway, if we hope that you are going to be somebody that has heard the advertising and all the promotion that we've put into this prior to that, and we'll see you out here today. And if we do get you on the air, we were going to let you know when this podcast will air so that everybody can listen to it and they can talk to their friends. So until a little bit later, we're going to sign off, and then we'll be back probably in about 15 minutes or so.
Yeah, and we'll see who our first guest is. I'm excited.
Our first victims. Here we go. So we're back live at the Health and Safety Fair.
Kind
of live. Well, we're recording live.
Sure.
But you're
we are
not
doing
hearing.
that.
You won't hear this today. You're going to hear it in the future. So that's kind of what makes it fun. And we have a guest at our booth, and it is Maria. Tell us who you are, Maria.
Thank you. Yes, my name's Maria Salas, and I'm the Health Equity Director at Sunflower Health Plan.
Okay, cool. Why are you here today?
We are here to provide free vision services to anyone that needs them.
That's cool.
Yes, we throughout the year we visit rural areas because we know that we have members with disparities that probably don't have access to certain services, so we come to them.
That's absolutely amazing.
Yeah, I love that.
I love that idea because I know the challenges that small communities, and the further out we go, the bigger the challenges are. So how long have you been doing this?
We have been doing this for about 2 years now.
Yeah, I look over there to where your booth is, and I'm seeing all these people, and I am just absolutely amazed. What did you do to entice all of them to come out this morning?
We let them know that the services were for free, and we tend to draw a large crowd with vision services because it's free prescription glasses. They get the screening. If they need readers, they get those. So it's all absolutely free. They don't even need to be one of our members for Sunflower.
That is
awesome.
amazing. That is absolutely amazing. We are thrilled that you're here. Is this the first time you've been to our health and safety fair?
It is,
Yeah.
yes.
I hope you enjoy it. As it rolls out during the morning, it gets pretty busy. So yeah, and we're going to have radio station here in a little while, and they're going to be playing it, so it's going to get a little bit louder, but it shouldn't affect vision.
Right. For
Yeah.
those of you who are listening and are unable to attend, of course, Sunflower Health Plan actually has a gigantic sunflower here today. That's really cool. Seriously, they have somebody wearing a sunflower costume, and it's awesome.
That's Sunny, our mascot.
Well, we're thrilled, and I'm so happy that you took me up on the offer to come over, Jed. Is there anything else that you would like the public to know about the service? How do they get in touch with you after today?
Yeah, they can reach out to us. Our main customer service number for Sunflower Health Plan, and there's no wrong door there at all. They can contact me, Maria Salas, if they have questions. We're going to be out in other areas of Kansas. Our next stop is Hiawatha, and our last stop for the year will be Garden City.
Excellent.
Nice. Way out west.
We're going to grab your contact information, card, and all that good stuff, because when we do these podcasts, we always make that information available so that people can see that information when they go. And for coming over and being a trooper, you get to have one of our little logoed
Thank you.
drinking containers.
You're
And
actually the first person to receive one of
Yeah.
those ever.
Oh,
ever
wow.
outside of the two of us sitting at the table. And we would ask you for a favor. Hey, we're going to actually promote our podcast. Tell the folks that you were here. Have them look for it wherever they consume their information online now, and when we'll reach out to you and let you know the day that this is going to actually go live and be on the air.
Absolutely.
Okay?
Thank you so much.
We're so happy that you came.
Thanks
All
for coming, Maria.
Thank
Thank you.
you so much. We're back again, everybody, and thanks for listening. And with us right now is
Tara Battrell-Sutton with Rivercross Hospice.
Tell us a little bit about what Rivercross Hospice is and does.
Okay, so hospice is not always the most exciting topic to bring up first thing in the morning. We do work with families and individuals who have elected to pursue palliative care, so they are no longer pursuing aggressive medical treatment. And our multidisciplinary team comes in. We have a nurse, a home health aide, myself as a social worker, and a chaplain comes in and surrounds the patient and their family with love, education, and practical support to work through the process.
it's sad to think about, but it's also very comforting to know that those services do exist.
Yes, our UPS driver actually, he said it the best, that he thanked us and said that we were there for his sister, and that it didn't make it any easier, but it made it better knowing that he wasn't alone. So just knowing that we can be there and support and love, and we do a lot of that.
Tara, how does somebody in Cowley County, if they're in need of those services, how do they reach out to you?
A good Google, River Cross Hospice. We are a small company. We are locally owned and operated. Our team is local as well. So we are highly responsive. If you grab one of those phone numbers, you'll get a direct person on the line, and they will dispatch out an email immediately, and we'll be there sometimes within the hour. So
Wow.
It's, very responsive group of people.
Yeah, well, we'll make sure that we spread the word, and we'll get your contact information, and we'll put it into podcast notes. Allie, is there anything you'd like to ask?
I'm just kind of curious about how many other health and safety fairs you've maybe been to.
I just did a couple weeks ago the Butler County Spring Fling.
Sure.
A couple weeks ago, and that is, if you've never been to that one, it's during the week. I saw a unicorn there with horse. It was a horse with a
horn.
with a horn, and then it had shoes on.
Okay.
And there was a llama and a rabbit, and I mean, there were, I don't even know how many people, but it was insanity. So, but
we need to put that in our notes. Talk
Yeah.
about a unicorn.
Yeah, I gotta look that up.
next year, I forgot to get her business card, but it was pretty impressive. But yeah, I always like this. Winfield's my hometown, so I love being here. I love the community.
Well,
So
we're kind of proud of it. It's well, like I say, it's home.
yes,
And what we do, and I love that local flavor and that being attached to that. So we're wanting to help, make sure everybody knows about you.
Yes.
Thank you so much for taking a little bit of time to come chat with us. Allie, is there anything else?
I think that's good for now.
Just
Thanks, Tara.
you're just another one of those people that makes living in our community a good place to be.
Why, thank you. You
Thank
guys
you
as
so
well.
much for visiting us.
Thank you.
All
Have
right.
a great day.
You too. Bye-bye. Hey, we're back again, and with us now is
Amy Jo McWhirt.
Amy Jo. What is it that brought you to the Health and Safety Fair today?
Well, Rise Cowley is sponsoring a booth here today, and as the grant coordinator for the Pathways 3 through Blue Cross Blue Shields of Kansas, I'm here to introduce myself and all the pathways that we're going to introduce into the community.
Now, I know all about this, but I'm going to play. Well, no, I'm not going to play. I'm just going to actually be dumb and say, tell us more about Rise Cowley.
Well, Rise Cowley is a coalition dedicated to making Cowley County a healthier place to live, work, and play. They are raising awareness, improving health, supporting collaboration, and energizing communities. Currently, they're housing the grant for the Pathways, which enables me to have a grant coordinator position. And they're helping me put these pathways into place in the community. So they are a coalition of like-minded individuals making sure that health is front of mind.
Yeah. How do you like it so far?
I really like it. I like that they're trying to focus on health in all policies.
It's a challenge, isn't it?
It is.
The whole thing that's going on. I mean, I know we've done this for a day or two. Yeah, and it gets, sometimes it's like, man, are we just talking to each other? So that's why we're doing this. We want to help get this out to the community a little bit more broad-based. So how does a person or an organization join Rise Cowley? Can you pass that information on? How do they do it? Can they get a hold of you, or what do they do?
Well, what they can do is they can get a hold of Allie Payne, and she would be glad to find what niche that they would best fit into. She is a rising star in the
isn't she, though?
community, and she actually happens to be the head of the steering committee for Rise Cowley right now.
She's the chair of Rise. That's exactly right. And we want to invite people to learn more about us because it isn't, they hear the word coalition and they're like, oh, well, how's that? Really, if you're concerned about keeping our community well or making it better, reach out to us. Come to one of our meetings. Find out what we're all about. We know that there's a place. There's got to be something that you're interested in that we can help you engage in activities in the community that make Winfield, Ark City, and the county in general a better place to live. That's what we're all about.
You know, one of the things that I think is cool about Rise Cowley is that you don't have to be connected to an organization to be a member. We actually have people who are retired and are just passionate about improving the health in our community, and I think that's awesome.
And they have their own little niche here and there, and so that's the exciting part about it, and that's why we're glad you took a few minutes to come over and chat.
Well, thank you for having me. I appreciate being here today.
All right, have a great time.
Thank you.
See you later. And we're back, and with us now is
Julie Fox with REACH of Cowley County.
Tell us what you do, Lou.
I am an early intervention specialist. I work with the REACH program in Cowley County. We also serve Elk and Chautauqua County. We work with children ages birth to 3 who have developmental disabilities.
Okay. How long have you been doing this?
Oh my goodness, this is my 8th, 9th year.
It sounds like that you guys fill a need for a pretty broad community, right? Do you have an office in Winfield or Arc City, or how does somebody get in touch with you if they need your services?
Yeah, well, you can give us a call, and unfortunately I don't have my number right here with me.
We'll actually get that from you, and we will post it in the broadcast notes so that when people will see this, they'll be able to scroll down and see your name and all of that and get that information. So that's okay.
Okay.
We're just glad that you took some time out to come chat with us. I know you guys have been to the Health and Safety Fair before, haven't you?
Yes,
Yeah.
that's correct.
How do you like it?
I love it. This is a great way to promote lots of different services that are available in Cowley County.
And you get to see a lot of folks today, don't you?
Yeah, and I get to connect and find out things I can share with other families.
That's it. That's the thing we try to tell people is why they should come out and what they can expect, because I don't think a lot of people they really know when they hear Health and Safety Fair, what does that mean? And so we're trying to raise that awareness as well. And we're just thrilled that you took some time out. Allie, do you have any questions?
I don't have any questions, but I do have a comment.
Okay.
For our health department listeners, I would like to highlight REACH. We work with REACH very often because we serve many of the same recipients through our WIC program and our home visiting program and things like that. And there have been some families who have had some challenges, and we have had staff from REACH work directly with our staff to connect with that family, and you can see the benefits of working with your organization. So I think it's a very valuable asset to our community.
Thank you. Do you mind if I share a little bit more about what we do?
Go
Of
for
course.
it.
So I said developmental disabilities. Our children have delays typically to qualify for our program. We assess different areas. So gross motor, your child's not walking, speech and language, not talking, feeding is included in that. So maybe your child's failure to thrive, or you just have some overall concerns about their social skills. Maybe they're not interacting the way that you think, or maybe they're not eating, using a spoon, using a cup, those kinds of things. And we can definitely do a free evaluation and tell you if they're eligible or not. There's no cost to our program, so it's just a matter of reaching out to us.
Super. That sounds cool. And age of the children?
Birth to 3.
Birth to 3. Okay, so good. So moms, dads, if you're facing a challenge you don't know, reach out to the health department, reach out to REACH, and we'll see if we can't get everybody connected.
Yeah, one more thing. We come to the home. You don't have to come to us. We come to you. So that makes it really handy and nice, too. We'll meet your schedule pretty much any time. So it's a great program, great service.
Julie, thank you so much for taking a few minutes to come chat with us. We hope you have a wonderful day and get in touch with a lot of good folks here in county.
Thank you.
Thanks so much. Bye-bye. And we're back, and with us now is
Emily Hedges with Rise Cowley. I work for Southwestern College, but I'm part of the Rise Cowley crew.
Okay, Allie, it's all yours.
Okay, well, that's very exciting because, as we mentioned earlier, I am also on RISE, so that's very fun. And I am also an SC alum, so that is very
nice.
special. Thank you for coming on the podcast today. What is it that you would like to tell our listeners?
All right. Well, something that I'm working on with Rise Cowley is our Rise Cowley directory. And this is a wonderful resource, and I would just really love everyone in the community to know that it exists. Not only the individuals who could really benefit from knowing this resource is there, but also for organizations to know that they really need to make sure they're represented in it if they're offering services that are going to help residents. So I'd love to just tell you a little bit about it.
Please.
If you go to the risecowley.org website, you're going to see an obvious place to click to access the directory. So we have it organized by all sorts of essential services. So to be in the directory, Three things. The organization needs to be located in Cowley County or through a state agency. If there's nothing in Cowley County, we'll take people from out of the county, but we want to connect people with the closest resource possible. Organizations and businesses that are in it need to provide some kind of necessary goods or services that pertain to, addiction services, childcare, clothing, education, employment, food, housing, legal tax assistance, medical care, recreation and social connections, transportation, senior services. And then finally, and this is important, the organizations and businesses in our directory all offer either directly or indirectly some type of income-based assistance. And I'm hoping that we're in the process of really taking a look at how it's organized, because our goal is for this to be as easy to navigate and use as possible. We'd love for people to go there and, if they have any of these needs, and it'll be something easy to navigate and be of great assistance. And promoting these kind of health initiatives is what Rise Cowley is all about. So.
Yeah, awesome. And I would like to speak to Emily's team. I know that they have done a ton of work to make sure that the resources that are available, that the information is correct, that it's current, and also that it's very relevant.
Absolutely. And I want to also kind of point to Winfield Public Library. The libraries, Winfield Public Library and Ark City Public Library, are huge partners on this. And in fact, Brianna, who's working with Winfield Public Library, has been the one that's been sitting there calling organizations, updating information, making sure people meet the criterion. And it's really been a group effort.
Yeah, that is a huge undertaking.
I think, if anyone is interested, like if you go there to the directory and you don't see your organization, there'll be contact information. So just reach out and we'll make sure you get represented in the best way possible. So.
Okay, awesome. And then I think, Emily, to wrap this up, I'm going to go ahead and say that even if you don't need these services right now, you should still take a look at their directory and just kind of have an idea of what exists, because you just don't know what you might need someday, or your neighbor.
Absolutely.
Or anybody that might be around you. So it's important to know about the resources that are available, ideally before you are in a crisis situation and need them.
Absolutely. Well, thank you so much. I appreciate
thank you
it.
for coming on.
Lily, we're glad you came by. Tell us a little bit about yourself. Do you live here in Winfield?
No.
Well, come and lean in. Where are you from?
Stillwater.
From Stillwater.
Oh, wow.
You came all the way up from Oklahoma for this? That's excellent. Are you having fun today?
Yeah.
Seeing things you probably... Well, tell me about it. Tell me, what have you seen, and what do you think about this?
I think it's cool, and I've seen a lot of health care for children and stuff.
Yeah. Did you learn anything while you were here?
That helping children is like
It's what a lot of us do.
helpful and good.
That's exactly right. Did you get any freebies? Did you pick up some cool things at the
Yeah.
booths? Yeah. Uh-huh. So I'm thrilled that you took time out to stop by and say hi. I know you're kind of nervous, but it's not. We're going to put you on rate, and if you will get when we're done, you give Allie your name and how if you have an email address or a phone number, we'll text you or something and let you know when our podcast is going to be, and you can be able to tune into it and listen and show all your friends and family, hey, that you were on our podcast for the health of it, Cowley County, and we're so glad you came by, and we've got a special gift for you just for being brave enough to sit in that chair and say hi to us, okay? Thanks. I hope you have a wonderful day. Allie, do you have anything else to say?
No, I don't. But Lily, have any of your friends been on a podcast before?
No.
You didn't have to go back and tell them all.
That's awesome.
Yeah, take that with you.
It's
You-
kinda
and we'll
cool,
prove it.
huh?
And we'll let you know.
Yeah.
We'll let you know. So before you go, we'll get your information, okay?
Okay.
All right, thanks,
so
Lily.
much, sweetie. Bye-bye.
Bye.
Hey, everybody, we're back, and with us now is a nice young lady named
Lizzie.
Lizzie. Lizzie, are you having fun today?
Yes.
Tell us a little bit about what you're doing here at the Health and Safety Fair.
Just to explore, have fun, and learn about stuff.
Yeah, hanging out on a Saturday morning. Yeah.
Yeah.
You've got all kinds of fun things, beads and everything. Looks like you've been into it already, huh?
Yeah.
Yeah. What have you learned?
How to help a baby when he or she's choking.
Okay, that's cool. Yeah. Is this the first time you've been to the Health and Safety Fair? No? You've been to it before?
Yes.
So you enjoy it enough to come back more than once, huh?
Yes.
Good deal. Allie, do you have any questions for Lizzie?
Yeah, Lizzie, have any of your friends been on a podcast before?
No.
Where do you go to school?
ACMS.
ACMS.
Okay,
so
Arc
remember-
City.
Yeah,
Nice.
you're gonna be able to go back and let everybody know that you're on with us, and we're gonna publish this in about it's gonna be about a week or so, and so you're gonna give Allie here the information before you leave, so that we can reach out to you. Do you have like a phone number and we can let you know?
We can call my mom.
Yeah, we'll let her know that you're going to be on the podcast and take one of these with you, because that's how you can tune into it and listen, and then you'll get to hear you talk to us, and we're so happy that you did. Okay, we got a little gift for you for doing this before you go, so we're going to give you that.
Thank
and
you.
we just want to say thanks very much. And do we have anybody else with your group that wants to chat with us?
Them too.
Them too. Okay, so we're going to move off from you and end it with these folks. Okay.
Okay.
So here we go.
Thank
Thanks
you,
for
Lizzie.
stopping by, Lizzie. It's
Thank
been
you.
fun. Thanks. Okay, with us now is another young lady from Arc City. Your name is?
Bella.
Bella. Thanks for stopping by to chat with us. What do you think about what's going on here at the Health and Safety Fair? Have you had fun this morning?
Yeah.
Yeah, what have you seen?
Like there's eye care ones.
The eye care one. Yeah, that's pretty cool.
The dentist one, and then
Yeah.
like the baby one.
Yeah, have you learned anything new? No. Oh, you just know it all.
Yeah.
Where do you go to school?
Arc City Middle School.
Middle school? Yeah. What grade you in?
7th.
7th? You're in 7th now, so you're going to go.
No, I'm going into
You're
7th.
going into 7th grade. Okay, cool. Anything special that you saw today that was kind of neat? Oh, you're supposed to say I'm on the podcast with the
Oh
health
well,
department.
yeah, I'm on the podcast, but
All right. 'Cause you know any of your friends been on the podcast other than the young lady that was just sitting here?
no.
No. Okay. Well, see, now you're going to know. You take one of these with you. This is how you can listen to it. In about a week, we're going to put this out and it'll be live streamed on air. Okay. So you'll be able to go on the internet, click on the button, and listen to the podcast. And there'll be a point in there where you're going to hear our little interview. Okay. We've got a special gift for you for being brave enough to sit down and chat with us. I hope you've enjoyed it.
Yeah, Bella, are you going to play any sports next year in 7th grade?
Cheer maybe.
Cheer.
Okay,
Yeah,
cool. Yeah,
Yeah.
that's exciting.
It's great. Thank you. Thank you so much for stopping by. Okay. Enjoy the rest of the time here.
Thank you.
See ya. Hey, we're back once again, and with me right now is a voice you're probably very familiar with. It's my buddy from KSOK, Shane Farley.
How are you doing, Tom?
I'm doing well.
Doing
Thanks
all
for
right?
coming out, man.
You do have a radio voice. I've said that before.
And a
It's
face to
very
go with it, baby.
you
know.
silky smooth.
Yep,
Yeah.
yep. Face
That's
that was
right.
made for radio.
That's what I tell people.
Yeah, you've not met
radio.
you've not met my partner in crime. This is my
No,
number
who's
2. This is Allie Payne. She is the the assistant administrator at the health department.
Okay,
She makes
all
sure
right.
that I don't mess up. And that's
a full time.
That's a full
time and a
job.
half
Yeah.
right there.
So hey, first time out here?
I've been in
Have you
Arc
been?
City.
Have you
yeah,
been to
yeah.
one down Arc
Oh,
City?
yeah. Yep.
Well,
It's been a while back.
What do you
but-
think? I know you guys are going to be touting the goodness of the Health and Safety Fair live on the air, where ours is a podcast, So it's going to come out in a week or so, and everybody can listen to hear what they missed. Tell us a little bit about.
Well, I mean, my impression of it, one, I think it's cool. And the whole glasses thing, like, I think, and you and I have talked about this before, outreach is such an important part of what you guys do at the health department, because you have to go out and find people. Because, I mean, let's face it, if we're being honest, like, seeking out health care is not something everybody's always wanting to do.
And
like,
they're not comfortable with it,
Yeah.
and it's kind of standoffish.
It is.
And it's rough.
And you think, oh man, I have to go wait in the line, and if I have a kid, I have to take my kid with me, and they're probably not going to be wanting to wait in line with me.
Right on.
So when you can come out, and that's what I think is the best part of this, is that you're coming out to people and you're giving them access. And that's the other thing too, you have a chance to meet like law enforcement here and things like that, because most of the time when you're doing that, it's in a stressful situation or some kind of horrific thing is going on. Right now it's just, fun and games and all that. So.
That's exactly right. And we're thrilled. I got to tell you, talking with Steve and everybody early on, you guys have bought in to help us promote this event so much this year. It's astounding.
We've talked about it a lot.
Yeah, and I am so happy that we got together and kind of formed this alliance.
Sure.
I think it's great. And we had the gal from Sunflower come over and talk about it. And it is the truth. You can go over here and get glasses, ordered today.
I was going to say, like, how are they actually, what all do they have here as far as what they're doing?
They got a screening vision machines. They've got I think they have like a little lab in their trailer.
Oh, do they?
So I think they can actually do these things here on site.
I was going to say, like, doing lenses and stuff?
Yeah, you got to walk over by that table. It's pretty cool.
I'll go check it out.
We were both like, really? And kind of amazed, because a lot of times you're restricted when you go on site. But they take the show on the road, and they specialize in serving small communities and people who have no access. And
going to people.
Yep.
That's become such a, over time it's been more and more popular in healthcare, but as you see it, and especially when you can be here at ground zero as they're doing it, that's cool. You can see like, oh, that's why you reach out to people, is because there are a lot of people, one, don't have the resources to do it. I'm fortunate enough that I do have health insurance and I can go do what I need to do. But in these instances, you can go out and actually have access and talk to people. And here at an event like this, where everyone's kind of hanging out,
and it's low key,
it's very much more. You can talk about. You say this bothers me, or I don't like this, or so. Yeah, it's a cool thing. It's a really good event.
Well, anyway, thank you so much for taking a few minutes out.
We'll
be listening for you here in a little bit.
Are you going to come talk to me?
Yeah, I will.
All
right.
It's
nice to meet you.
If there's one thing I can do, and it's talk. You and I know that.
Yeah.
All right, man.
He can't
so
do that.
From your standpoint, what is the challenge in trying to, be Tom's right-hand person? I mean, is it like, okay, I'm putting her on the spot. She's getting this odd look.
You get that, yeah. No, it's okay. She knows she has to deal with me every day.
Does he have the messy desk? What does he do? Does he leave his lunch out on the
Oh, so you're wanting to know
room?
some
just some dish. Yeah, some dish.
Okay.
Yeah.
I will say,
Does he fall asleep?
he doesn't do that. No. He works when he's at work. His desk, though, it's organized chaos. It is absolutely chaos.
I can see that. That's
but
mine too.
he knows where everything is. It's incredible. I'm like, how do you do that? But he knows.
It's a unique
you know what?
horizontal filing system.
I leave it alone. I leave it alone.
Don't you hate when someone goes in there and messes with it too? And you're like,
she's that exact opposite though. That her office is pristine.
There's nothing on top of the desk.
Oh no. She will.
I don't even like a fingerprint on my desk.
Yeah, we balance each other out in that respect.
Well, that's good. And don't you hate it when someone comes in and starts moving things around, and you're like, and it doesn't look like it, but they're messing the system up.
That's
it. You just caused me trouble. Well, guys, good event. Appreciate it, and thanks for having me.
We'll see you in a little while.
Yep.
Take care. Hey, everybody, we're back, and with me now is...
Hi, I'm Jason. I'm with Precision Psychiatric Solutions.
Well, thanks for visiting with us, Jason. Tell us a little bit about what you do and why you're here at the health fair today.
Yeah, so we're here at the health fair today. What we do is we offer standard psychiatric care, right? But one of the things that makes us really unique is that we do pharmacogenetic testing. And so what that does is it gives us the opportunity to take a look at your genes and kind of treat your mental health a little bit better. The example I'd like to use is, for instance, if you have depression, kind of the standard treatment algorithm that most psychiatrists use, they'll start you on a SSRI, and that'll take like 2 weeks to build up in your system. The trial period might be like 8 to 10 weeks. If it doesn't work, we've got to taper you off of that for another 2 weeks. And so we're looking at a couple months, 3 months just to try a medication that doesn't work. And so with the pharmacogenetic testing, there's a large population out there that SSRIs just do not work for, right? And so after trying a couple, 2, 3, SSRIs, potentially you're still struggling with depression, nothing's working, you're dealing with some side effects. We just really take a lot of the trial and error out of mental health treatment. So,
being in public health, everything that we do is prevention, and yet we're part of our community, and we do community health needs assessments, and we formulate community health improvement plans, and consistently from year to year, the mental health component always ranks very high as a need in the community.
Yeah.
And so it's really nice to know that we've got providers of all different types for individuals to be able to reach out to. So I know you brought us the information, and we're going to put it in our program notes so that people can click on that. But is there anything specific you would like to tell folks about how they can reach you, or what's the best way to be in contact with you?
Yeah, so we serve all of Kansas, right? Because we do telehealth, mostly, and so what that allows us to really get out into the rural areas of Kansas, because we have a real passion for that, just because of where we've come from as individuals. We grew up in rural communities. But if folks want to get a hold of us, they can get us at PrecisionPsychiatricSolutions.com. You can schedule a intake appointment with us from there, or you can give us a call or text message at 785-390-8385.
Now, are you located in the local community, or are you from out of town?
So we're actually out of Baldwin City and Gardner, Kansas, but through that telehealth option, we can really see anyone anywhere. Plus, my wife's family is from here in Winfield, so
cool.
we're local all the time. We're down here once a month.
Good.
So
Well, when you get back down, we'll connect, and we'll bring you into the health department where we set up our official podcast and do one of the full-blown ones with you. We'd love to learn more about what you guys do and find out about it and let the public know.
All right,
okay?
Fantastic.
Thanks so much for stopping by. Go ahead.
I'd like to say something.
Allie, I'm sorry.
Yeah.
Sheesh.
I know that May is a really special month for mental health awareness.
Yeah.
And that anytime people are talking about mental health, there's the stigmas that are attached to that. So is there anything that you would like to share with our listeners about mental health and stigma?
So I think probably a lot of the reason that stigma exists, right, it really amplifies itself, right? Because there's a stigma, people don't get treatment, right? And so then other people see the manifestations of not getting treatment. And so it's a preventative thing, right? If you take care of yourself early and you remove some of that stigma, you're not going to perpetuate the stigma. I think the other thing too is we've seen a lot of horror movies too about asylums and that kind of thing in popular culture, and I think people are getting a little smart on that, where it's Hollywood. That's not the way real things are. And at the end of the day, people are people, and as long as you have a brain, you're gonna have some sort of mental health struggle. That's just part of being a human being, So.
Awesome.
Yeah.
Thank you so much.
All right,
We
awesome.
appreciate it. Allie, I'm sorry. I did not mean to cut you off.
You're good.
Not at all. We really do appreciate you stopping by. We want to learn more. We want to help you get the word out in the community. Okay?
All right. Awesome.
Thank you.
Thanks. Appreciate it.
Bye-bye.
Loved it.
We're back, and with us now is...
Hi, I'm Dorita Bloyer, your friendly social media content creator with the Walnut Valley Farmers Markets and Arc City Farm and Art Market. I'm also helping the garden program at Irving Elementary School here in Winfield.
Cool.
That's very exciting.
So you work with the farmers markets
Yes.
and Irving School.
Yes.
Okay. Tell us about what you've got going on.
Basically, I am with the Food Fellow and K-State Research and Station and Rice College programs, trying to promote healthy lifestyles in our community.
How do you do that?
We're participating on programs at the farmers markets like Pop Club for Kids, a bus shuttle to help people without transportation be able to come to the markets. And also, we're trying to visit farms to film about the process of planting, harvesting, and packing products so they can share with the community where the produce, meat, and other foods they consume at home, how they come to life in our markets.
You've got a lot going on there.
Yeah, I'm pretty excited, and I hope more people can join us. All ages can participate in these programs.
How do they get involved in it? How do they need to reach out to the extension office and ask for you, or?
We are promoting the sites for Rice Colley and also the farmers markets. So during the markets, we talk about in our booth with the customers that walk around, and we offer the programs and when are they going to start. For example, Pop Club that starts in June, so kids can come and join us as well.
Okay.
Yeah.
So basically you have a booth that's at the farmers market both here in Winfield and the one in Arc City, and you're there during the markets, and people can connect with you that way. And do you have information then that they'll take with them, or?
Yeah, we have information. We have pamphlets and little
Flyers
that they can take.
Excellent. Allie, what about you? You have questions?
I don't have any questions, but I do think it's very exciting that you guys are working on a shuttle to the farmers markets. We haven't had anything like that, so that's very exciting.
Yeah, that'll be cool. If we can get people to use that, that'll be amazing.
So today at this fair, we are trying to ask people what is a good place to stop so people can join us, like housing or the library. So come.
So a place where people can walk to and then they can get on the shuttle and go.
So come and let us know if you don't have transportation, or if you have a friend that needs transportation, and share with us so we can help you get to the markets.
Excellent. Anything else you want to say?
No, thank you very much
for
having us.
This is your first time that you've been with us, hasn't
It
it?
is,
Yeah.
and it's amazing how people are sharing and trying to help in this fair and other programs.
Yeah. Thanks
Thank
so
you.
much for taking a few minutes to talk to us.
Awesome.
Thank you.
See you later. Hey, everybody, we're back, and with us now is
Robin Henderson.
Robin. How are you?
I'm doing fine.
I know you. Tell me, where do I know you from, Robin?
Oh, well, Tom, you know me from working at the health department.
Yes, you did that.
That was about 9 years ago.
It's been a minute.
And I was there for about almost 4 years.
Yeah. And then from there you went to?
Oh, where did I go? I ended up going back into child welfare. I worked for TFI, and that's where my roots were.
Okay, and now you're at?
I am at Eagle Nest.
Oh, Eagle Nest.
Yep, the executive director at Eagle Nest.
There you go. Tell us a little bit about Eagle Nest, what you guys do, and how you help folks in the community.
Okay, well, Eagle Nest is a faith-based nonprofit organization that has been in Cowley County for 25 years. Our organization serves women and children, in the community, with primarily the women, teaching them how to look for work. We are wrapping our services around justice-involved women and women who are coming out of treatment to help them get back acclimated to the community and resources, and primarily to help bridge those gaps with employment, housing, and also keeping their health at the forefront, because a lot of those women, when they are incarcerated or in treatment, they come out with what they had or less than what they had, and so we are really trying to wrap around those women. However, historically, our organization just kind of was a broadcast of casting services to every woman in all circumstances. However, when I took over 3 years ago, it was kind of we needed to focus a little bit more our impact on the women that data had been showing in our community had been kind of not wrapped around. And so that's what we've been really working towards. We have a couple of different initiatives going on right now to really kind of see what we can do and be more innovative and different and evolve with the times.
Robin, I know you have been your work at Eagle Nest has been very innovative, and it's been focused too recently on helping find transportation for people who don't have it.
Right.
Because they miss out on a lot of the vital services, be it doctor's appointments or even being able to go to the store and places like that. Tell us a little bit about how you guys have done. You've worked with some other people in the community.
Oh yeah, so that our effort with bridging the gap with transportation needs comes with working with it started off with a co-project that was with KU that is no longer happening in our community, but that bridged a lot of relationship with RISE. And so we partner with Rise Cali. We partner with the Council on Aging, which is a provider of our local transportation system. And so what we do is we are basically a conduit of funds to make sure that there's funds available for free rides currently to individuals on a first come first served basis. And so Eagle Nest, we basically utilize some of our funding sources as well as our funding sources through our Rise Heat team to provide that to Council on Aging. And so our focus with that initiative is providing transportation to seniors, veterans, and then also people who need rides to get food or doctor's appointments. We have a two-spoke with that where we provide rides outside of our community to doctor's appointments that are specialty appointments in like Wichita mostly, and then we also provide rides locally to doctor's appointments. I know for sure we had some people come to the health department in the past. The grocery stores, things like that, just because it's just something that our community at the time for people who couldn't afford it were not receiving. So that's something that Eagle Nest has been doing since I've been there.
For people who don't know where Eagle Nest is or how they can get in touch with you, where are you guys located?
So we are located at 112 East 9th Avenue. We're diagonally across from the Chamber of Commerce. We're right east of Luigi's Italian Restaurant. So like if you're at the City Hall building, you just continue to head east on that same side, on the north side of the street. We're right there.
Can't miss it. It's got the big display windows. It's always looking really nice.
Yeah.
Allie, what about you? Any questions for?
Yeah, I would also like to point out, Robin had mentioned Rise Cowley a few times, but she is wearing a Rise Cowley shirt here, representing the coalition. We've had several other members that have come representing the coalition. I think that's very important. So I know that you're connected to several different initiatives in the county. So I just kind of want to ask you a broad-based question that we have. But the question is, what health issue do you think deserves more attention?
That is a very hard question to answer because there's a lot of different health issues. But I would just probably get a more like broad answer to that. And I think that poverty is a health issue. If we look at like the circumstances that create poverty, then we'll be able to kind of like see more like where to start. Like maybe where to like pinpoint specific things. So if we follow that, we follow the people who are like challenged with those things, then we'll be able to kind of focus our focus services or wrap around prioritizing what health issues are affecting our community. I think that's one thing, but I probably would say transportation too, because like that's one of the things that we are really working towards. So transportation also, education, all of those things are social determinants of health.
Well, hey, we love that answer because it's very much rooted in prevention, and that is who we are.
Yeah, absolutely. Robin, thank you so much for taking a few minutes to come visit with us. We hope that you make a lot of good contacts today, and we really, truly appreciate all of the work that you do in the community for the betterment of others. Thanks for coming.
Thank you guys for having me.
All righty, thanks. We're back, and with us now is...
I'm Becky Reed with K-State Research and Extension here in Cowley County.
Becky Home-Ecky.
Or Techie Home-Ecky.
I'm so glad you stopped by. Tell us about what's going on.
Always lots of stuff in progress, and it's summer season already. Where did the year go? So exciting to think about youth programs, family programs, things that we can do, kind of that whole family to connect.
You're never, ever in a slow mode, are you?
There's not.
I don't know that in all the time I've known you, that there's ever been a time when you're down and you're just not doing anything. You are always going 100 miles a minute.
There's lots of opportunities and different audiences, and we also serve the whole county, so it's also being intentional to connect with people.
Yeah, well, we're thrilled you're here because I know you guys are involved with us a lot in partnerships at the health department. You're also a vital component and member of Rise Cowley, but just the things that you guys do, and then all of the stuff you do with 4-H and the fair, and oh man, the extension office is involved with everything. At least I think so.
There are days.
There are days. Yeah. So talk to us about what's big and exciting and that you're really wanting to let people know about today.
Absolutely. So with youth events, a lot of times there's youth that are going to be home alone, or it might be that chance that there's the kids that are going to have their first summer gig of a job which is often babysitting. And so I offer a babysitting class. We call it Sitter Solutions. It's for ages 11 to 15. So that will be coming up. I have 2 dates scheduled the end of May. May 28th will be in Arc City, and May 30th will be in Winfield. But based on interest, I can offer those at any time. I usually just want a minimum of 5 people to do that. So if you are listening and this has already happened, don't worry. Just call our office, 620-221-5450, and we can get a class scheduled, and that's always an opportunity.
We're going to make sure that your contact information is always in the podcast notes, so all of that will be available to people listening. And I want to really encourage folks, if you need to get a hold of Becky and you can't reach her there, heck, call us at the health department. We have her on speed dial. So we'll make sure that we give you a good handoff and all of that. And also, Becky, the folks from KSOK are going to be broadcasting live today in a little while, and they're going to need folks to talk. So I hope you take the advantage of that as well, because that's all part of this health and safety fair gig. So, Allie, you have anything you want to ask?
Yeah, we can go ahead and start wrapping it up. So I'd like to go ahead and ask you what you think makes a community healthy.
Community healthy. Well, it is just awareness of that our choices, we aren't in control of our choices. And sometimes a healthy choice is not doing something. So it might be not overeating or not eating that extra dessert or something like that. So it's not always about what you need to add. Sometimes it's about what you don't need to do as well.
Something you can take away. Ooh.
Absolutely.
No,
Hey, we were talking about this earlier. One of the questions that we had earlier was if you could design a health campaign, what would it be about? And I asked Tom that just to get started today. And he had said something very similar, to just be conscious with your choices, drink some water, take some steps.
Yeah.
Simple things like that.
Those little things that incrementally build up over time.
And it doesn't have to be all or nothing. One of my programs, we talk about being healthy-ish. So maybe it's you're eating fast food, and the healthy-ish option is getting vegetables on your sandwich, right? The tomatoes and lettuce. Okay, yes, maybe it's not healthy, but it's healthy-ish, and just being strategic during your day.
I love healthy-ish.
I want a T-shirt. I'm going to make a T-shirt.
I think that's fun.
I think I'd be in on that.
Yeah, we'll buy some.
So I think that could be our new county campaign.
I love that.
Healthy-ish.
Healthy-ish.
That's good. One other thing I want to ask. Are you still doing Dining with Diabetes?
I'm on a pause because they're actually updating the overall curriculum, but I have a new program that I'm looking at probably in the fall called Live in Control, and it's still kind of a diabetes management, but it has the support person come with the person that's diabetic. So it's kind of a less, still focused on food choices, but less about the food tasting at these events, but then talking about the support and, again, those decisions and healthy-ish. How can you be healthy-ish as a household?
Sweet.
Love it.
Sounds good. Becky, thanks so much for taking a few minutes
Sure.
to come chat with us.
Yes,
Okay?
thank you.
See you later.
Bye.
Bye. Thank you for joining us for this edition of For the Health of It, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. Independence Day is almost here. A staple of this great American holiday is celebrating with fireworks. However, fireworks can lead to some pretty serious injuries and maybe even death. So here's your local health department with a few tips to help keep you safe this 4th of July. First, know your local ordinances and regulations. Don't set off any fireworks unless you're allowed to, and make sure to obey any burn bans. Second, check your local forecast. If it's too dry or windy, fires can quickly grow out of control, so avoid using fireworks in those conditions. Third, before you set off fireworks, keep a means of extinguishing fires on hand, like a fire extinguisher, bucket of water, or a water hose, just in case a fire would break out. Next, pace yourself and only light one firework at a time. And don't forget, once those fireworks are lit, move away fast. Lastly, if you have kids with you, be sure you supervise them. Never let children use any fireworks, even sparklers, unattended. Helping you celebrate Independence Day safely is just one other way the health department works hard every day to help you stay well.